Thank you, Mr. Speaker, sir, and I thank the Honourable Member for his question. Honourable Speaker, sir, the Ministry of Health and Medical Services continues to ensure its commitment in executing one of its key strategic outcomes, which is to attract, select, recruit, retain and empower the right people to create a diverse and inclusive and engaged workforce. Mr. Speaker, so in the last 2 years, much focus was on the effort to retain and reduce the rapid attrition of nurses, which occurred in 2021, 2022, and this has been successfully achieved given the enormous reduction in the number of nursing leaving the ministry. The ministry is also trying its best to ensure that other health professionals is given the best working conditions and incentives within the ambience of the law. There was also measures introduced by government earlier for job security purpose, and this includes increasing retirement age, salary increases for the last 2 financial years, recruitment of retired workers for scarce skill areas, opportunities for training and capacity building locally and abroad, collaboration with partners for overseas short work attachments and seminars. At the Ministry of Health and Medical Services, our medical staff who serve in the rural and maritime areas and occupy staff quarters do not pay rent. Honourable Speaker, so even though there is no specific retention monetary incentive in place for most of the cadres, the following existing strategies are implemented for retention and recognition purposes. Medical officers, separate salary structure, which has the base salary start from step 4 to step 7, and in addition to their salary, a medical on-call allowance, called MOC allowances, is paid depending on the health facility a medical officer is serving in. Medical officers who are serving in the rural and remote areas are eligible for rural and remote allowance, which classified into merit and single entitlement. Medical laboratory scientists, all medical laboratory scientists are recruited at remuneration of Band 4, Step F, Band F, Step 4. Significant improvement in workforce retention found given the current field medical laboratory scientist positions of 96% that cushion the current demand of laboratory services in all health facilities. Dental officers, they are paid with on-call allowance wherever the officer is attending on on-call duties. The ministry is facing difficulties in recruiting dental hygiene positions due to lack of interested applicants, as the training institution no longer offers specific diploma program, but are offering degree oral health instead. This is probably why many choose to take up dental therapist, as it is a higher band grade than a dental hygienist. The ministry is currently still in the process of working with the development of the National Strategic Plan for our health workforce 2025-2034, and our technical working group has been having meetings on a monthly basis. So this plan is to guide the ministry with a required need of human resources in all health professionals for the next 10 years, in alignment to the demand of the services and international standards. As for medical imaging technologists and pharmacists, positions are areas that the ministry is still facing difficulties in attracting qualified applicants. Due to no interested applicants, as graduates opt to take a better offer from other organizations. Strategies of salary adjustment within the eligible salary range were not approved. But the ministry will continue to work on other retention strategies that can attract these kind of recruiters. Honourable Speaker, sir, the ministry is also working on re-evaluating allied health professionals such as environmental health, medical imaging technologists and pharmacists, when necessary to accommodate additional responsibilities to grow in service demand and emerging need. The ministry has encouraged that some measures that the government and ministry has put in place are working. We are seeing a slowing down of staff attrition rate from the ministry. We may not be able to match salaries of remunerations in the private sector or abroad, but we can make their working conditions attractive enough for those who have the passion and commitment to stay and serve the ministry and the nation. And I thank you, Honourable Speaker.